So if you call and ask, and make sure you ask what all is included, because some of them, like the doctor that I chose to go with, he does the surgery, and for his self-pay patients, he also does hernia repair, which if you're overweight, more than likely you have what they call a hiatal hernia, which is in the esophagus, stomach area somewhere in there. Um, and he'll repair that for you while he's in there, and there's no charge for that. Um, he is in Houston, Texas, and his name is Dr. Alanis, Alanis. He's done over 3,000 procedures. He's been doing this since 1980 something. And like I said, I'll put his website address at the bottom of the screen or whatever at the end. Um, and for the gastric sleeve, it's 11,500 for self-pay patients. That includes the hernia repair. That includes his fees, the hospital fees, anesthesia, anesthesiologist, the nursing, the hospital stay, which is for 2 nights, and pre-op like blood work and stuff that you have to do at the hospital a few days before you go in. And his was the best price that I found so far, and a lot of people thought, oh my gosh, that is so cheap. So if it's cheap, why is it cheap? What, because, you know, not necessarily the cheapest price is, the best place to go. So I called them and I asked them why was it so cheap, and she said it's because the hospital that they use is a smaller hospital, and they have all their bariatric patients there. They specialize in patients with bariatric surgery. So, there's not going to be like teeny little tables and itty bitty gowns and people to judge you while you're recovering. So, because he has done so many procedures and he uses that particular hospital, they are giving the hospital side, not the doctor, but the hospital is giving the discount, at least for now. So, that made me feel a lot better. Every time I've called his office, his wife is Linda, and she's the nurse. And every time I've called, she's always taken my call, or she's called me back immediately. Everyone has been very nice there, and that was before they even knew that I had money to pay. This was just calling and asking questions about the surgeries, different types of surgeries, and things like that. So so far, I really like them. Um, the only thing that I can say is if you know you have insurance, your insurance won't cover it. If you think you're going to be a self-pay, the doctor is going to require whichever surgeon you go to, and you should probably ask whenever you call them. Like, I had sleep apnea, so I had to have a sleep study done. And so I've had a lot of things done before my actual surgery because my insurance wouldn't cover anything related to weight loss surgery, weight loss anything, because there's, you know, I can't think of the word, but in the policy, they won't do it. So, I did everything separately, and it took me about 6 months to get, sleep studies and echocardiograms and things like that. But I did everything separately, and everything is good. And the only thing I have left to do now is the EGD, which is an endoscopic procedure where they, put the tube down your throat and look in your esophagus, stomach, and like the first part of your intestines to make sure that everything's okay. I'm sorry I'm talking fast, but I've only got 10 minutes, so I'm trying to get everything in before I have to get cut off. Otherwise, I'll have to make a part 2. Let's see. Most people, when they go in, they have to do they call it upper GI, where you drink the barium, and that's what most people do. Now, because I've had like GERD, indigestion, that type of thing, for about 10 years, they're worried about having like scarring in there and strictures, something like that, where your scar tissue grows together and you can't pass food. And they just want to make sure that I don't have anything that would prevent me from having surgery, because nothing worse than wanting to have the surgery and they go in to do it and you can't because there's a problem that they didn't find out about. So, I'm having the EGD tomorrow. And, oh, one more thing, as far as Mexico, gosh, I hope I have enough time here. So, I'm going to take a pause